1 year ago this month, you were in a Nebraska hospital. You had contracted the Ebola virus. You were fighting for your life, and now here you are, healthy a year later. What is it like as you reflect on that 1 year anniversary?
You know, it's incredible. I'm just so grateful for the prayers of so many people. I know that people all over the country and all around the world were praying for me. And I'm so thankful for the Lord's answer to those prayers and His gift of life. You know, it's been an incredible journey, and got to meet so many people, and the Lord has really used it to further His work, and I'm thankful for that.
Talk about Ebola in West Africa right now. It sounds like it's relatively contained. How would you describe the status of it right now in West Africa?
Right. Well, we're still having cases every week in Guinea and Sierra Leone, but only one or two. And Liberia has been free of new cases for about 8 weeks now. So there's been great progress. You know, we're really down to the kind of the getting to zero stage now. But because people have accepted the reality of what Ebola is and have made the changes they need to make in terms of, you know, hand washing and reporting right away if they have symptoms, reporting to the hospital for screening right away, and you know, just taking those steps, changing how they do their burial practices. You know, people have taken those steps, and it's allowed, with a lot of help from outside. I mean, a lot of teams in there doing contact tracing and those kinds of things, and that's what's allowed us to get to this point.
There's also a new vaccine that is being used. How is that helping to contain the spread of Ebola?
Right. Just a few months ago, they came out with data that one of the vaccine trials had shown very positive results, and so now they're using it when someone gets sick with Ebola. They're vaccinating their contacts, the people around them, the people in their village, and that's really helping, I think, to reduce the spread during this time.
So would you say that there's less concern right now that there will be another epidemic?
There will probably, you know, Ebola has been popping up in different areas in West Africa over the last 40 years. There will probably be more outbreaks, but this does give us hope that, you know, with a vaccine in our toolbox, if you will, it gives us hope that you know, that we won't have another epidemic on this kind of scale.
There's a lot of work still happening. There is survivor care that's going on. There's also trauma healing groups. Tell us about that.
Right. SIM, the mission I work with in Liberia, has gotten very involved in providing care to Ebola survivors. There's a lot of complications that people can develop, problems with the eyes, nerve damage, arthritis, things like that. As after effects of Ebola, and those things require treatment and follow-up. So we have an Ebola survivors clinic that's very active. We're also working with people who've lost loved ones. You know, so many people have lost spouses, parents, children, brothers and sisters, you know, community members. People have been through a lot, and they really need to receive the healing of the Lord and God's love for that. And so there's a trauma healing program that's getting started. SIM trained actually 80 people during July to start trauma healing groups. So we're hoping that this will give people an opportunity to grieve the losses that they've suffered and really receive the love and healing of the Lord in their lives.